Hello, Blake.
Hello.
Welcome back. We're going to do an assessment of your abdomen and your blood vessel areas today. I have you starting off without your shirt because it's easiest to see if you have any abnormal pulsations. I can see if your muscles are contracting appropriately, and it'll allow me to listen to all of your arteries appropriately. So, what I'm going to have you do is lay completely flat on your back. And we're going to assess for pulsation. So mainly I'm going to come down here by your feet area, and I'm going to look up, and I'm basically just going to see if I see any abnormal pulsations of like your aorta, and I'm not seeing that, which is great. So then I'm going to have you take a deep breath after I do my initial auscultation, and then I'll have you hold that breath, and I'll listen to you while you're doing that as well. Somebody use the bell on my stethoscope. Just starting in your right lower quadrant. Sorry, I know it's cold. Okay. Perfect. So you sound good. I'm going to push and do the same thing. I'm just going to feel. Okay, so now what I want you to do is I want you to take a breath and I want you to hold it. I'm going to do the same thing. Okay, go ahead and release. And then go ahead and do like kind of like a crunch for me, but hold it. Yep. Okay, so I was looking for any like masses, hernias, or separations, and I didn't see that in any of the three positions that we did, so that's great. I've already listened to you in all of your quadrants, so that sounds great. I'm going to listen to your aorta now, and then I'm going to listen to your renal arteries and then your iliac arteries, okay? So first for your aorta, I'm going to go above and to the left. Just listen to that. It sounds normal. So I'm going to go to your renal arteries. So I'm going to go about 3 centimeters above your belly button. Perfect. And then your iliac arteries, I'm going to go 3 centimeters down from your belly button and like lateral. Perfect. So I'm going to listen to your femoral arteries as well. So these ones are in your groin area, okay? Perfect. So now we are going to listen to your liver and your spleen, and we're going to listen to basically see if you have any friction rubs with those. So your liver is over in your left upper quadrant, or I'm sorry, your right upper quadrant. And I'm going to listen to your spleen, which is basically the same, just on your left side. Okay. And then I'm going to do some palpitations, or yeah, palpate them. Any pain? Any pain?
No.
Perfect. Okay, so I'm going to percuss them as well. We're going to do these. We'll do your liver and your spleen, and I'm going to do all your quadrants at the same time. So I'm going to start down in your right lower quadrant, or your right lower quadrant like I did before. And I'm going to kind of do some Any pain?
Nope.
Perfect. Okay. So now we're going to measure. I'm going to go from Perfect. And we're going to measure. Okay, so for that is about, I'd say like 7 centimeters, which is perfect. I did hear a dull sound over your liver, which is good. Now we're going to do your gastric air bubble. So this is on your left side, kind of like your 56 intercostal space. So we're on your left side. So here, and that's what I just measured, but I did it over here. But I'm gonna repaint. Okay. So with this, all right, now I'm going to check your kidneys. So go ahead and sit up for me. Okay, so with this, I'm going to have you sit up a little bit. I'm going to put my hand, I'm going to kind of like hit my palm of my hand kind of into my other hand. Just tell me if you have any pain here, okay?
Nope.
Perfect. Okay. So now we've already palpated around. Go ahead and lay back for me again. Sorry to have you sit up. I just can't get to all the areas. So I'm just going to feel about your umbilical ring. Everything feel normal for you?
Yes.
Okay, perfect. So now I know I've already palpated around your abdomen area, but this time I am going to do a deep palpation. So I'm going to do like 5 to 8 centimeters. And just let me know, because this is a little bit of a stronger touch, just let me know if there's any pain. Any pain?
No.
Perfect. I'm going to do the same thing with your liver. Same with the spleen. Any pain with that deep palpation?
Nope.
Okay, perfect. So I'm going to do one more thing with that deep palpation. So for your liver, I'm going to put my hand under your back like this. I'm going to push. Feel okay?
Yes.
I'm going to do the same thing here. Feel okay? Perfect. All right. So now, check that out. We're going to check something called your Murphy sign. This could indicate something with your gallbladder. So we're going to go right under the border of your liver. Any pain in here?
Nope.
Perfect. All right, so negative Murphy sign. So your spleen is kind of the same thing. I know I already felt it before. So we didn't have any pain with that, which is good. With that, so I'm actually going to put here, I'm going to go towards your armpit. I'm going to have any pain.
Nope.
All right. I am going to feel for your aortic pulse. This should be between 2 and 4 centimeters wide. Feels good. Perfect. So I'm going to check for your appendix now. So this is also known as the McBurney's point. I'm going to check your right lower quadrant. I'm going to do 2 things for it. So first, I'm going to push. No pain?
Nope.
Perfect. What about when I let go?
Nope.
Perfect. So now what I want you to do is raise this right leg, hold it, and kind of try to fight against me. Any pain in that area I was pressing?
No.
Perfect. Okay. So we're good there. All right, so I'm going to check this. I already checked your gastric air bubble. I did get a tympani sound, which is good. So now I'm going to do your abdominal reflex. I'm going to use this reflex hammer, and basically I'm just going to draw lines over your stomach to make sure that you're having appropriate contractions with your abdomen. Perfect. Okay. So that is your abdominal assessment. So now what we're going to do is, you can kind of stay how you are. We're going to do your blood vessels. So I'm basically just going to hit all your points of pulses across your body. I'm going to get my phone for this one because I'm going to check something called your jugular venous pressure. So go ahead and turn your head to the right for me and keep it there. So with this, I'm going to measure basically from your sternocleidomastoid muscle to your sternum with this. Yours is 7 centimeters, which is great because it should be less than 9. All right, so now I'm going to palpate your pulses. I'm going to go to your carotids, to your brachials, to your radials. I'm going to hit your femorals, your popliteal, your pedis tibialis, and your posterior tibius. So I'm going to do one at a time because we don't want to include your circulation here. Perfect. Plus 2. Plus 2. I'm going to check your brachial. Perfect. Plus 2. Plus 2. Check your radial. Same. Plus 2. Plus 2. Okay, so I'm going to feel your groin. This is for your femoral pulses. Plus 2. Plus 2. Perfect. I'm going to do your popliteal. Excuse me, though. Plus 2. Plus 2. All right, I'm doing your pedis tibialis. Plus 2. Plus 2. And then your posterior tips. Perfect. Both of those are plus 2 as well. All right. So we checked all your pulses. We've already assessed your abdomen for any hernias, masses, or anything like that. You're also free of lesions or scars. So now that I've palpated everything, I'm going to listen with my bell just to make sure you don't have any bruises or anything like that. And that should conclude our assessment. I'm just going to do the same thing. I'm just going to listen this time. I'm going to listen to your femorals. Popliteals. All right, perfect. Everything sounds great. So that will conclude our assessment for today. And I will see you next week.